I don't look at it as a patient with a disease. I look at it as a person with a story to tell. Every patient has their own struggles. I feel now it's a privilege and an honor to be able to be with those patients in their most difficult times. So a typical day starts with a nice big glass of hot coffee. So usually I start work at about 8:30. We will do our morning rounds, is where we go to the wards to look at the patients that has been admitted, the day before. And then we start clinics, seeing patients who are having chemotherapies, who's following up with their treatment. Usually the clinic runs all the way till lunchtime. And we normally would have our lunch breaks and lunch meetings. So there are different days where we have different meetings during lunch. And then we will go back to having our evening clinics, where we will continue to see patients and mainly follow-up patients in the evenings. This is the time where we also do radiation planning, where we go down to the physics department to plan all the different radiation treatments that will be carried out over the next few days. What is different in Sunway Medical Centre Penang is we have a very good cancer support system, all the way from the management down to our support staff. Our focus is to make sure that our cancer patients are well supported. We also have an established multidisciplinary team meeting, which is an MDT meeting. Groups of consultants such as oncologists, surgeons, radiologists, pathologists. We would sit down and discuss interesting cases or cases that are difficult, to have different ideas and thoughts on how do we manage such patients. This is to ensure patient gets the best treatment available and inputs from different specialties. So I think with the support and with these things that we have, I think it makes working here very rewarding. I think it's very important to give time for work and for yourself and your family. When I'm home, I like to chill with my kids, with my family, and I bake. I love baking. I love feeding my family with unhealthy food. But I think it's a way to relax and to enjoy time together. I think the most common misconception that people have when they hear oncologist is a lot of people will ask me, isn't it very depressing? Every day you're seeing cancer here and there. As I work longer, my experiences change and I mature more. I don't look at it as a patient with a disease. I look at it as a person with a story to tell. Every patient has their own struggles. I feel now it's a privilege and an honor to be able to be with those patients in their most difficult time. Sometimes it's the lowest times to be diagnosed with cancer. We have celebrated patients being cancer-free, patients from being unable to walk to being able to walk again. Sometimes we look at things that we cannot change, but not knowing that every day we're here, we're actually given a life to live. We do not know what tomorrow will bring, but we have today. To live today and make a difference today and be prepared for what is there to come in the future.